Birds of prey can hide illnesses very well, so it is important to perform health checks daily to spot signs of poor health. All health checks should start at the bird's head and work down towards the tail to stop the spread of any diseases. Today we will be completing a health check of our kestrel, Knave. First we will discuss behaviour.
In the wild, kestrels are very good at hiding illness or injuries to avoid being eaten. The behaviour is a key aspect of knowing whether a bird is unhealthy. They may become abrupt, aggressive or irritable, or self-mutilate by feather plucking, which could also be a sign of stress or ectoparasites such as feather mites. Irritability or impatience can be a sign of endoparasites. Any unusual behaviour change should require a vet check to rule out illness.
Next are the eyes. Birds need to have good eyesight to hunt for prey, so it's vital that their eyes are in good condition. The eyes should be clean, clear, bright and have no damage such as scratches. Damage to the eyes can become infected, which can lead to other discomfort and, if not treated, loss of the eye. The eyes shouldn't be red, swollen or have any discharge. Red or swollen eyes can be a sign of conjunctivitis and will require vet treatment.
We then move on to the nares and the beak. The nares and nostrils should be clean and clear with no signs of discharge or sneezing. The beak should be curved and not chipped, cracked or rough. Laboured breathing, swellings or sores around the beak should be investigated and treated by a vet. Normal breathing should be relaxed and barely noticeable.
Kestrel's appetite may fluctuate slightly, but should any dramatic changes occur, like stopping eating altogether, a vet should be consulted as it is a sign of internal illness. Many illnesses can be spotted by a decrease in appetite, which is why it is so important to monitor food and water consumption to spot illnesses early so they can be treated.
The weight of a kestrel can change quickly depending on food or water consumption and if they have passed faeces or regurgitated food. Kestrels should be weighed weekly, and keeping a record will help you to monitor fluctuations. Rapid weight loss or gain can be a sign of endoparasites and should be checked by a vet. An easy way to check a bird's body condition without scales is to feel the chest, and you should be able to pinch the keel, but it shouldn't be easily visible.
A bird should produce droppings daily, which consists of faeces, urine and urates. A change in colour, consistency, amount, smell or difficulty passing not caused by a change in food could be a sign of internal parasite or digestive problem. This should be investigated by a vet and so that treatment can be prescribed.
Feathers should be monitored to make sure that they are adequate for flying and to spot issues quickly. Healthy feathers should be bright and curved up smoothly and should not have any notches or chunks missing, as this can be a sign of feather mites. Dull or damaged feathers and general loss of body condition can be a sign of underlying health issues, which will require a vet check.
When caring for kestrels, you will begin to notice their normal posture and activity levels. Unusual positions such as sitting low on the perch, head drooping, abnormal sleeping positions or sitting on the floor when free-lofted can be a range of problems. Serious signs such as balance loss or seizures may be a serious problem with the bird's brain or nervous system and will require a vet check.
When stroking a bird's chest or limbs during a health check, there should be no lumps, bumps, scratches or swollen areas. Large lumps under the skin could be tumours, which should be examined and diagnosed by a vet. If scales on the legs are raised, cracked or peeling off, it could be a sign of scaly leg mites, which can be treated with sprays or creams.
Kestrels are very good at hiding illnesses and injuries, so it is important to look out for any signs such as dizziness, blood, cuts, scratches, wing dropping and open wounds. Other signs such as refusal to stand on one leg, reluctant to fly and protruding bones can be serious limb injuries which should be treated promptly to prevent infection or prolonged pain.
Some common causes of illnesses in birds are foreign body ingestion, fumes, toxic substances and poor immune systems. With some injuries or illnesses, it can be hard to stop them from happening. However, there are measures that can be taken to prevent them from becoming worse. These include maintaining high levels of husbandry, good nutrition, correct use of disinfectants and correct biosecurity of ill birds.
Thanks for listening to our video of how to health check a kestrel. Hopefully it makes it easier for you guys in the future.